Hello and welcome to Feeding a Baby Part 2. On this particular section, we will look at why we demand feed. We will look at baby poop, and we will discuss colic and winding and things like that. So the first one we're going to go to is why we demand feed. And the reason we demand feed is because babies are like us. They don't just do the same thing all the time, and they're growing. So to give you an example of how they grow, when a baby is born, their tummy is about the size of a hazelnut. Very, very tiny. And this little tummy only holds about up to an ounce for bottle feeders. For breastfeeders, it's very hard for you to tell. Nature has it all sussed out at the beginning because you've got colostrum, and as the baby grows, your supply grows and changes. So this is where bottle feed or breastfeeders get a bit worried sometimes. They don't know how much the baby's getting, but you know because they stop feeding. For bottle feeders, it's always easier to have a little look about how much they're doing, and it just gives you an idea. So tummy is about the size of a hazelnut when they're born, and this grows very rapidly to, I think it's about day 5 or 6. I think that's about the size of an apricot or a small tomato. Big change. And then there's still rapid growth going on. By the time you get to about 10 days to 2 weeks, you've got about the size of a hen egg. So that's a lot of growing, isn't it? So you can understand that babies grow at different times. And because we all grow at different times, you just have to look around you, it's kinder to do the demand feeding. In the early days, in the first couple of weeks, we just feed babies as they need them and give them lots of comfort. When you, at 3 months, that's the time, maybe 2 months, it's time to start thinking about, other things, like a bit of distraction to get them going, to get to 4 early. But in these early weeks, we feed them as they need to be fed. You feed them during the day in the bright light, at night time in the dark, because I want babies to think that night time's a bit boring and not really worth being awake for, so that they just feed and do like a dream feed and go back to sleep. And that's just putting in some nice patterns from day one. So going on to baby poo, which is sorry, it's a very creaky chair, this, isn't it? Baby poo. So it's different for breastfeeders and bottle feeders because breastfeeders have got very little waste product. So breastfeeders first, the baby poo is after the colostrum, and then that goes through the meconium. That's the tarry bit. Both babies, of course, have the meconium. Once that clears, the poo turns yellow. So for breastfeeders, it's very watery, and it can just look sort of like yellow ochre or yellowy, and can sometimes get the consistency of like cottage cheese. For bottle feeders, it's a bit thicker because there's more waste products. So it goes yellowy, and it is more the consistency of peanut butter. There can be a little bit of green in it. This is the gallbladder kicking in, so you'll see that on both sides. There's loads and loads and loads of stuff on the internet with lots of multicolored pictures, so have a look, so you get an idea of where it all is. No need for me to go into that here. However, what you do want to do is get used to the look and the smell of your own baby's poo, because then you will notice any differences. Once the poo's turned yellow, we don't want any black bits, we don't want any red bits, we don't want to be too constipated, and we don't want too much diarrhea. Now, babies will get soft ones and hard ones from time to time, and the diarrhea is exactly the same as the feeding. So as we said with feeding and dehydration, if they miss one feed, don't worry about it. If they miss 2, go and ask for help. With diarrhea, it's much the same. If they get one watery stool, don't worry about it. By the next one, if the next one's in a few hours time and it's solidifying and you can see an improvement and the baby's feeding, and then the next one it's okay, so you can see it going up, that's fine. If you have diarrhea again, especially if the baby's not feeding, go and ask for help. Always think of dehydration. So in the everyday things, baby's feeding, bit of diarrhea, next time few hours later, you can see it solidifying. Don't worry, baby's feeding. Baby not feeding, there's more, go and ask for help. Okay. The next one, oh, of course, smell. Did I mention that? Just if it gets smelly, if it's a different smell, there can be an infection going on in there. So if it smells bad, just go and ask for help. On to colic and wind. All babies get colic to a certain extent, and this is simply due to immaturity. As we said, the tummy is very small and there's an awful lot of growing to be done. So you think of the difference of a newborn baby and a month-old baby. There's quite a difference. So a newborn baby, tummy there, month-old baby at least this size, so a lot of growing's been going on. As babies grow, their tummies will grow. And as their tummies grow, the flora and the bacteria that is good for us that we need to digest will grow too. And as it grows, it produces gas. So this is where the gas comes from. You know, people go, I'm doing properly, I'm doing good feeding, they're well fixed, you know, there's no air going in. Where does the gas come from? It comes from growing, and that's the backhanded compliment. During a growth spurt, you will get more colic. That's just nature. How does it happen? Well, when a baby is born, they're still very immature, and as we say, the gut is very immature. For digestion, we have peristalsis through the gut, which is a wave-like motion that pushes our food along and aids our digestion. For newborn babies, their peristalsis could be very, very sluggish. So the milk sort of is very slow at moving through. Also, the bore of the gut, that's the inside of it, can be very, very small. So what can happen is that baby has to feed, off it goes, very slowly, very sluggishly, and wanders along to where it's going. Then the next feed comes along, down again, off it goes, and as it comes along, it hoovers up all the air that's from the growing gut. It comes along, and eventually it will meet the last feed, and you will get an air bubble, and that is colic. Now, colic isn't fun. It's anyone who's had tummy cramps knows all about it. Colic, we try to avoid by winding babies. It doesn't really help because that will only go for the top bit. Rubbing your baby's back, patting the back gently, a lot of people like to put their babies along their arm like this and tuck them in, and that, you know, so nice and comfy for the babies. Colic will last because of the food about an hour after feeding, so you know it's colic. It's a backhanded compliment, you know they're growing, and some people say it's a really good stage in the baby's development because the baby learns that the parent makes it all right. I'm in pain, but because my parents got me, I feel safe and I feel secure, and it's all right. We also, I forget their winding generally. Some countries don't wind at all. I think it's absolutely hilarious. You know, if you go to France or somewhere, go, I'll wind the baby, they go, what? So, not everybody wins babies. I want to talk to you a little bit about vomiting, the difference between posseting and, you know, real heavy vomiting. So posseting is normal. All babies posset. They just got past the full point. So when you sit them up, they get a little bit of air here and it goes, out it goes. All babies will do that. That's just natural part growing up. They get a little bit too much. I get lots of calls from people saying they're very distressed. My baby is projectile vomiting. Posseting is not projectile vomiting. Posseting will sort of go down your back, all over you, all over the baby. That's it. Projectile vomiting comes out with terrific force. When I mean terrific force, you're at one end of the sofa, it'll go over the other end. It is, and hit the wall the other side. It is very different, and of course, you ask for help immediately there. So be reassured. Posseting just goes a little bit. Projectile vomiting is very, very rare. I'm very happy to say. And if that happens, go for help immediately, but it is very, very rare. I think that's it really that we're going to do at the moment. A little bit about those of you in the NHS. You have in your red books, you have growth scales. So when baby clinics come open, that's great. You can go and get your baby's weighed. And at the moment, of course, there are no baby clinics and you're all being left a bit high and dry. Some people like to weigh their babies, especially first-time mums. There's a way you can do this. Just get on the internet and buy a set of scales. They often come as pet scales. There's got a little white tray, and you see they're very much like the ones the midwives use and the nurses use. For us, the NHS, they have to be all super duper, but yours are good enough. And weigh the baby. Try to do it no more than once a week, or you'll just drive yourself mad. The time goes along the bottom, the weight goes up the top, and you will see the growth curve. So that's quite an easy thing to do yourself. If that's what you choose to do, a baby will start on a curve. So say they start, make it nice and easy, on the 50% of the 25. So you want them to bounce around that curve, like that. They go up and down, but you don't want them to go whoop down or whoop up. Either way, go and ask for help. A lot of people worry about acidy babies and they change lots of milk because they think they've got allergies during this colicky period. Sometimes they help, sometimes they don't. You can certainly try them. Go to the pharmacist. As long as you go to the pharmacist, get the appropriate stuff, that's absolutely fine. Try not to change your milks too much because that will actually cause it. Because if you keep adjusting the milk, that will upset the babies as well. The anti-colic milks can be very expensive, and feeding a baby is an expensive thing anyway. There is a final cause of colic that happens, and that is often due to after birth. The baby's going to have a bit of a sore head. So babies who had a traumatic birth or fast birth or sometimes a section or forceps, whatever, when, as we said before, the bones slide across and come out. Some babies don't have that process of the sliding around and coming out, like a caesarean birth. Others too quickly. If you think this is the case, there are professionals out there that can help you, but they're outside the NHS. So the one that springs to mind would be pediatric, I've got the name here somewhere, a pediatric cranial osteopath. So that's a branch of osteopathy that specialise in pediatrics. So if you do go there, that's outside the NHS, make sure they're properly qualified. A properly qualified professional will be delighted to show you their credentials. And sometimes it works very well. Children often express pain through their stomachs. Hence the child who is nervous going to school gets a sore tummy, things like that. So I hope this has all been useful to you. The next section that we're going to be talking about communication, relationships, and a bit of a timeline to give you an idea of what happens when, so you have an idea of where you're going. So lovely talking to you, and talk to you again soon.